Good day. My name is Josh Lagasma, and I'm a student nurse for today. For today's video, is we're gonna doing the intradermal injection for skin test. So the rationale for this is for the nurse is to assess the patient has an allergy on a specific medication, and after that check the doctor's order and checks the medication administration. The rationale for this is we sure that if we administer the right medication, thus it will lessen the harm of the patient. And after that, checks the label on the medication carefully against the EMR to make sure that the correct medication is being prepared, and to sanitize our hands or do hand washing. For the rationale for this is to prevent the spread of the microorganisms. And next is we need to identify the procedure to the client. The rationale for this is an order for us to know if we're handling the right patient. Also, the patient have an awareness what will be going to him, and why is it necessary to do with it. And next is do the privacy of the patient. If necessary, if you have a curtains, you just need to close the curtains. The rationale for that is it is for the patient must feel comfortable. So now is I'm going to prepare the materials that I am going that I am going that I am using for the procedure. And here I have syringe. This is 1 cc. This is 1 cc, one measure. And also I have a sterile water for injection, since I don't have a ampule, so I am gonna use this one. It was so big. The next procedure prepares the medication vial for drug withdrawal, and also mixes the solution. So this is our so for the next procedure, prepares the medication vial for drug withdrawal. So this is my medication, and mix the solution if necessary by rotating the vial between the palms of our hands, then not by shaking, and also removes the protective cup or clean the rubber cup a previously opened vial with antiseptic wipe by rubbing in a circular motion. So we just need to do antiseptic wipe for this medication. So for the next procedure, get the syringe, and after you get the syringe, uncup this syringe. So make sure that your syringe is sterile. So after removing the cup, so if the doctor prescribe you on how many millimeter or how many ml that you're using, that you're going to get the water start out, and then you just need to do it. And after that, so after getting the syringe, so insert the syringe into the vial. So just like this. And get some millimeters. So I'm using 0.5 ml. And now after we're getting the sterile water, remove it. We need to remove it and exchange it into the same size.
Needle lagi needle.
So after that, explain the procedure to the patient. So good morning, ma'am. So now I am going to assess you, which is the intradermal injection, the skin test. To know the identity of the patient, you just need to check her wristband, so that so that you will know so that you will know. And so also explain the client that the medication will produce a small wheal. Sometimes it is called a bleb. A wheal, it is a small raised area like a blister. So the client will feel a slightly prick as the needle enters the skin. And after that, provide the privacy to the patient. And also select the cleanse selecting the cleanse to cleanse the area, the arm of the patient. So after that, avoid using sites that are tender to the patient or inflamed or swollen, and those that have lesions. Also apply gloves as needed, as indicated by the agency policy, and cleanse the skin at the site using a film circular motion. So, we're gonna get the cleansing solution, and now we're going to cleanse the site that we are going to inject to the patient. So in circular motion, so just like this. And so after that, prepares the syringe for the injection. Prepare the syringe for the injection and remove the needle cap while waiting for the antiseptic to dry. So while waiting, we just need to use the glove before we're gonna going to inject the patient. So now we just need to uncup the syringe, and after that, discard it. So now grasp the syringe in your dominant hand close to the hub, holding it between thumb and finger. Hold the needle almost parallel to the skin, with the level of the needle up. And after that, with the dominant hand, pinch the skin of the patient. So now we're going to pinch it with the non-dominant hand and pull the skin at the side until it is taut. So now we just need to inject it carefully and slowly. So now we're going to inject the medication carefully and slowly. So now, sir, I'm gonna start injecting the sir, huh? So after that one, gently withdraw the syringe carefully at the same angle as it was. After that, activate the needle safely and device applies a bandage if indicated. So we're gonna go in, so we're going to apply bandage for patient. So do not massage the area, and also removes the gloves that I'm using, and perform again the hygiene. So that's all to retrieve. So now, encircle the injection site with ink to observe for redness or induration, hardening per agency policy. So we're using the black pen. So So why I don't use the red pen? It's because so don't use red pen. So don't use red pen to encircle the area that you injected. It's because when you use red pen, you will be confused because um, uh, maybe the skin of the patient has a redness or rashes after that one. And after that, documents all relevant information, records the testing material given, the time, dosage, route. So when you put the time, you just need to put time near from the circle that you will be injected. So I'm going to put the time here into 30 minutes. So since it is 9 p.m., so I'm going to put this 9:30. So done. Evaluates the condition on the site into 30 minutes. Depending on the task, measures the area of redness and induration in millimeters at the largest diameter and document the findings. So document if the client had a positive or negative skin test result and follow the agency protocol on labeling of the allergies.